This is Dr. Howard Strassler with a Hints from Howard on enhanced visualization with the use of magnification, how to select a pair of surgical telescopes and loupes, what are the different features that we can use in understanding the terminology when it comes to selecting a set of surgical telescopes. There's no doubt we want enhanced visualization when we practice dentistry. Whether it be in diagnosis or in treatment, seeing better works to our advantage, to our patient's advantage. Seeing the fine detail of oral structures to diagnose, seeing the fine detail of restorations, of treatment to see better, works to everyone's advantage. When we talk about improved visualization, we also have to include the fact that we need to illuminate the field. The loupe systems that are available also have, as an adjunctive piece, the ability to put on headlamps. When selecting a headlamp, you want to look at how comfortable they are, whether they add additional weight to the frame themselves, that the beam that the headlamp is projecting has a beam uniformity and doesn't have any glare, so that your eyes aren't getting tired or being fatigued during treatment. We want to have color fidelity, that we have color accuracy when we're looking at intraoral structures. We'd also like to have the ability to adjust light intensity. Although one would think that you'd always want to have the highest beam possible, in reality that causes greater eye fatigue and can cause pathologic changes to the retina. We also want to have a beam size of that headlamp that's compatible with the loupe itself, with the field of operation, with the loupe and without the loupe in place. And then the battery itself that's powering that headlamp, is it going to be corded, or is the battery system going to be incorporated into the frame? These are all choices that we make, and when looking at headlamps that are connected to the loupe itself, we want to make sure that all the factors are compatible with our practice of dentistry. Now, I want to review some terms. I'm going to define them so you can understand when you're speaking to a manufacturer's representative, if you're getting magnifier surgical loupes for the first time, or if you're upgrading. And those terms that we're going to define include magnifying power, resolution, field depth, also referred to as depth of field, field width, working distance, weight, and working angle. All of these come into play when making decisions about the loupe. Magnifying power refers to the size of the image, not its clarity, but the size. Optical manufacturers don't agree on the definition of magnifying power because there is no standard of measurement for magnifying power in the loupe market. Even though specific labels have been used, most manufacturers actually round up to the nearest 0.5 power. And then you have the difference between a diopter and magnifying power. A diopter is a measurement of a refractive power and applies to a single corrective lens. We know it as reading glasses. Loupe systems, binocular telescopes that we use generally as healthcare professionals, contain multiple lenses within that loupe, and it refers to different image sizes at a certain working distance. For example, you'll hear 2x or 2.5x or 3x, which is 2 times the size, 2.5 times the size, 3 times the size. So a reference to diopters describing magnifying power is not appropriate. In fact, when you look at magnification, and here we're seeing an example, that on the upper left-hand side, this is the actual size, what we see, and then for Design for Vision, what's seen with their 2.5 telescope. When we look at actual size compared to 3.5 magnifying power telescopes, and then 4.5. And you can see there's a significant difference. And keep in mind, we see and focus, our brain allows us to focus on a smaller image in order to do our detailed work, even though the field of what we're seeing is much larger. So reading glasses are examples of diopters, and you know reading glasses have diopters of 1.75. That doesn't mean it increases the image by 1.7 times. Uh, that's more a measurement of what a single lens does. And in fact, the higher the diopter, the closer the image has to be seen at that diopter. In fact, dentists over the years have bought diopters to see better because it does give you a magnification, but not the type of magnification that we see with a binocular loupe. Resolution is another feature that we want to understand and ask about when we're selecting telescopic loupes, binocular telescopes. Resolution refers to the capability to visualize small structures and is set by the quality of the optical design and the use of precision lenses. So we're talking about ground lenses that are giving us a high quality binocular telescope. Traditionally, this is accomplished by enlarging items viewed by the naked eye, and depending upon the lens quality, there can be differences in peak visualization across the entire field of the lens. The better the resolution in the center, you want a better resolution in the center of the lens and not at the periphery. High quality binocular telescopes give us higher resolution, and in the case of good binocular telescopes, you get what you pay for. From some of the legacy companies, they're giving us high-quality computer-designed lenses that are giving us high resolutions, which is what we're looking for when we practice dentistry. Field depth, the depth of field, is the range of focus delivered by the loupe. The longer the field depth, meaning that you're focused, if you're looking at a maxillary premolar in the mirror, that in that mirror you'll also have in focus the first molar, the second premolar, and the first premolar if you're focused primarily on the second premolar, that's a depth of field. It allows you to view the entire operating field, and it means less neck and eye strain. It's also dependent on the lighting that you have and the optical design, the magnifying power, and your ability to accommodate through your own ability to focus. The higher the magnification, the less the depth of field. So when we're looking at the size of the operating site, when we're looking through loupes, we appreciate a wider field of view because it's easier and quicker to adjust when shifting from our naked eye view to the loupe. A wider field also promotes less eye fatigue. Field width is linked to the diameter of the telescope, the optical design, the magnifying power, and like I said, the higher the power, the smaller the field. Newer designs have much more expanded fields. Working distance is the distance from the loupe lens to the object being viewed, and in dentistry you want it to give us a good ergonomic position. Generally, this position has been defined as between 11 and 17 inches, generally around heart height, where the object being viewed is relative to where our head is positioned. And this working distance also depends upon the length of our upper torso. Manufacturers may define working distance as short, regular, long, extra long. Don't take a generalization. Ask for the distance in inches or in centimeters. Then weight comes into play because this is really the entire comfort of the frame with the loupe attached to it. The weight of the system has become an increasingly important feature among new magnification users because as we increase the power and we get larger loupes, the weight increases. The glasses themselves will generally have attached to the frame to the elastic to hold it in place or some type of eyeglass cinching device. And then we talk about working angle. Working out angle, also referred to as the angle of declination, allows the user to work in a comfortable, ergonomically correct position. It prevents neck and back pain, and so we want to choose a model that delivers the right working angle for you. Several of the flip-up products and through the lens can be set to the required ergonomic working angle that'll be fit for you. And in fact, you want to work with a manufacturer that has a representative that understands these features. And so when you're looking for a set of loops, you want to start with that you want something that's ergonomically correct. If you're going to have neck and back pain, if you're going to have eye fatigue, why have a system like that? You want a system that has side shields for safety protection. You want it to be waterproof. You want it to have a head strap that's comfortable and will support the weight of the frame. You want it to be corrosion resistant as well as that you can wipe it down with a disinfectant without damaging the lens or the frame. You want to know that prescription lenses can be added in the future and updated as your prescription changes. You'd like it to be adjustable or customized to you. You want it to be comfortable and weight distributing with its nose pad or a series of nose pads. You'd like it to be lightweight and durable. In fact, when you look at the loops that are on the market, you really have three choices. You have through the lens, where the loop is attached to the glasses themselves. You have flip-ups attached to the glass frame. And then you have a headband with the loop attached to the headband. I find the most durable systems are the ones that are through the lens. And the reason through the lenses are more durable is that the alignment will be constant. With flip-ups, there's the chance that the telescope itself can shift within the flip-up device, and then readjusting it to optimize visualization and resolution can be difficult. And so the most important factors when it comes down to it for a high quality loop is resolution, the width of the field, your visualization, and the field depth. And those are the things you want to look at when you're comparing systems. Well, this was Dr. Howard Strasser with hints from Howard on enhanced visualization with the use of magnification.